Hi, my name is Allison Rusgo, and I work in the physician assistant department. So I am one of the assistant clinical professors in the physician assistant department. I've been a physician assistant since 2012. I am a graduate of the Drexel Physician Assistant Program. Prior to PA school, I obtained my master's in public health at Emory University, where I concentrated on global health and community health and development. Following my graduation from physician assistant program here at Drexel, I transitioned to clinical practice. I worked in emergency medicine at Lehigh Valley for several years, and then also worked in inpatient cardiology. In 2016, I transitioned from clinical practice to becoming full-time faculty here at Drexel University. So I think what brought me back to the College of Nursing and Health Professions really was the excellent experience that I had while as a student in the program here at Drexel. I really appreciated the diversity of our class and the relationships that we were able to form with our professors while I was a student. I also enjoy all of my clinical rotations and felt incredibly prepared to practice as a physician assistant post-graduation. And I really wanted to have the opportunity to return to the program and provide that similar opportunity to students. So with regard to my teaching, one of my primary roles in the physician assistant department is serving as the internal medicine clinical coordinator. So I have the opportunity to work with students as they progress into their second year in our program. And I love doing things like site retention and site recruitment. So meeting our preceptors and talking with them. I have the opportunity to help students as they navigate the internal medicine world in terms of what to expect on their rotation, as well as helping them to master their internal medicine learning objectives. In terms of service, recently our department has had the opportunity to partner with the Dornside Center for Neighborhood Partnerships, working very closely with Dr. Loretta Jamat and her team at the Wellness Hub. We've had the opportunity to bring our students to their monthly community dinners. Our students have the opportunity to take blood pressures while they're there, to educate the community members about hypertension, as well as helping them to understand the role and scope of practice of physician assistants. In terms of my research, recently, as I've begun my doctoral journey, one of the things that has become more and more important to me is trying to figure out the intersection of the physician assistant world and our clinical practice and how that interfaces with public health. I've had the opportunity to work on some qualitative research projects, specifically focusing on the West Philadelphia Promise Zone and thinking about how we can, again, meet the mission of our program and meet the mission of the university in terms of engaging the community in decisions that affect where they live, work, and play, and how we can also think about incorporating physician assistant students into that research as well. So following my graduation from the University of Rochester in undergrad, I knew that I really wanted to focus my efforts in medicine and in the healthcare field, but I wasn't exactly sure what avenue to pursue. I began that journey with my master's in public health from Emory. And after kind of having the opportunity to see a bird's eye view or a more macro view of healthcare, I wanted to then focus on something a little bit more micro and think about the way to integrate my public health knowledge was also having an opportunity to think about patient care. I really enjoyed the collaborative aspect of being a physician assistant. I think that one of the things that's really important in our profession is sort of the team-based nature, as that's kind of how our profession originated, and the relationships that we're able to build with our supervising physicians as well as with other allied health professionals. I think one of the things that I enjoy most about being faculty here in the physician assistant department is the versatility. I think that every day for us is different. Some days I have the opportunity to lecture to our didactic year students, or maybe I'm helping them in the procedural lab, working with splinting or placing IVs. And then maybe the next day I'm visiting a clinical year student who's about to graduate, and I'm seeing them at their clinical site and watching them interact with their preceptor. It's really been exciting to watch them grow and learn and progress and really increase their medical knowledge and their ability to interact with the different healthcare providers and the patients as well. One piece of advice that I have received and passed on to some of our newer faculty members is advice that I received from our former department chair, Dr. Patrick Oth. And Pat, when I first joined as faculty, Pat told me, always say yes. And although, at first it was seeming challenging to jump right in to become a new faculty member, whatever opportunities presented themselves to me, I always found myself saying yes. And then in terms of my scholarship and those research-related opportunities, things like writing my first book chapter, as well as applying and beginning my journey as a doctoral student. Again, all new opportunities and things that may have seemed challenging at first, but simply saying yes has really provided me with a unique opportunity to grow.